It's been a while. Okay, I don't have a microphone, so I'm just going to try to be as vocal as possible. Hello, everyone. Thank you for being here. Welcome to our presentation of our Community Health Needs Assessment data from 2018. My name is Jamie Kroll. I'm the Community Health Educator here at Good Shepherd, and we are going to dive into all of the data that we worked really hard with our community partners to collect in 2018. So hopefully this can give you a comprehensive perspective of where our community is at with their health issues and where we're at with some of our greatest strengths and benefits. And I will turn you over to Tessa Elliott from the Hospital Council of Northwest Ohio. Tessa, can you hear us?
Yes, hello. Hi, everyone. Can you hear me?
Yep, yes, we can hear you.
All right, great. And can everybody see my screen okay?
Yes.
Okay, great. Great. Well, thank you, Jamie. And thank you, everybody, for coming today to the release of the 2018 Umatilla County CHA. I'm really sorry that I couldn't be there. I am all the way here in Toledo, Ohio. We're having some beautiful weather today. I hope you guys are too over in Oregon. Like I said, my name is Tessa Elliott. I am a Community Health Improvement Coordinator with the Hospital Council of Northwest Ohio. We are a nonprofit hospital association, again, located in Toledo. And we have been conducting community health assessments and similar documents, so community health improvement plans and other types of services since 1999. And we've actually been working in Oregon since 2011. I want to say, I think in front of you, in addition to the actual CHA, I believe you guys also have a evaluation worksheet, a participant feedback worksheet that I will ask that you complete as we're going through this presentation. It's very simple. It just asks, as we're going through the data, what surprised you the most? What would you like to see in the report next time? So again, as we're going through the data, just jot down some of your thoughts. At the end of the presentation, Jamie will collect those from you, and then she will scan those documents to me. If we have time then at the end of the presentation, I will ask just that a handful of you volunteer and share some of your thoughts on the presentation. So I'll kind of go through the questions and ask you just to, tell me what surprised you and just to kind of go over some of the questions. But again, that will occur later in the presentation. Also in front of you is the actual CHA document. It is about 135 pages. We obviously will not be able to cover every single data point within the CHA document. So please, before you go to bed, take it into bed with you, read it. It's wonderful light reading. It's riveting. It'll keep you up at night. So we will just be touching on some of those indicators as we're going through the presentation today. So please feel free to follow along. The PowerPoint presentation that I will be using will follow the sections of the report as we go through. Okay, we will then go ahead and jump in here. So here we have our funders. Obviously, the CHA wouldn't have been possible without these individuals and organizations. And here we have the individuals and organizations that were involved in the development of the health assessment. So they helped select questions when we had our question selections meetings back in September of 2018, and also helped with some of the feedback with the health assessment during our rough draft meeting earlier this year. So I would like for all of you to give yourselves a round of applause for just, there was a lot of hard work that went into the development of this document. All right. Here we have our project staff from HCNO. I like to think I do everything myself, but it is truly a team effort with the development of these documents. So we have all of our staff members here from HCNO. In addition, we also work very closely with our professors at our local university here at the University of Toledo. They make sure that we're using appropriate research protocol and that we're just using good research, and they help us analyze the data. They are an unbiased source with the research, and we truly could not do this without them. Here is just an overview of all of the topics we will be covering today. As you can see, we'll be covering quite a bit. Not only will we be covering the adult and child data that we collected via the mailing that went out in fall of 2018, but we will also be covering the Hispanic adult and child data that was collected via convenient sampling, also in the fall of 2018. Okay. Now, before we dive in to the actual data, I'm going to go through the methodology and the process that we use to collect the data within the health assessment. So, for the design, we do still use a paper and pen version of the survey, and we send it via the mail. So you may be thinking to yourself, you know, it's the 21st century, shouldn't we be doing everything online? Well, we've tried it in the past, and we have not gotten very good responses. In fact, people say that, you know, they don't want the government to have their answers forever. They feel like they're being tracked if they were to take it online. We've attempted to use web links and QR codes, and that just has not been effective. So it's still paper and pencil for now, and we still get phenomenal response rates using this methodology. In terms of the instrument development, so for those of you that were involved in the question selection in September, you'll recall that we used the majority of the questions come from the national surveys, the BRFSS from the CDC, that stands for the Behavioral Risk Factor Surveillance Survey, and the National Survey of Children's Health. So the majority of the questions that are that were on your surveys came from that national source. We did that to be able to compare the majority of our data to the national and to the state numbers, right? So I always like to use the example. Instead of creating our own tobacco question, we're going to use the national question so that we're going to be able to compare. If we were to use our own question and let's say a number came back and it was 32% were current smokers, we wouldn't necessarily know if that was good or bad or indifferent. In addition, since this has been our third round doing our community health assessment in Umatilla County, asking the majority of the same questions also gives us that trend data to be able to see if a lot of the community health improvement initiatives that you guys have implemented in your county have made a difference. The same thing goes for the child. We used, the majority of those questions also came from the National Survey of Children's Health. Then looking at the procedure that was utilized. So for the mailing portion, we did a 4-wave mailing campaign for adults and then parents of children 0 to 11. So we surveyed adults ages 19 years and over. We did a random selection of 1,200 adults and 2,400 parents. So anybody that had a Social Security number, received SSI benefits, had a driver's license, would have been randomly selected to take the survey. So once we have our names, we then implement our 4-wave mailing campaign. So we send out a advanced wave mailing. Again, this goes to all either 1,200 adults over the ages of 19 or 2,400 parents. And in that advance letter, it says you may be randomly selected to take the survey. They don't know this, but they've already been selected, but they don't know that yet. And everything comes from Umatilla County, so nothing says the Hospital Council of Northwest Ohio on it. Then 3 weeks after the advanced wave mailing is sent out, we send a first wave mailing. In this mailing, it says, congratulations, you've been randomly selected to take the survey. In the packet comes a copy of the 16-page survey, again, the letter, a pre-addressed, pre-stamped envelope, and a $2 bill. You may be wondering to yourselves, why a $2 bill? Why not $1? Why not $5? Well, years ago, we used to use a $5 bill, and we were working with a pretty cheap county here in Ohio, and they were like, listen, we just don't want to fork out the money for the $5. Let's try 2. So there was a bank teller at the meeting who said that banks just have thousands of these $2 bills. So we did a pilot study, and we found out that the $5 and the $2 gave us the exact same response rate. So ever since then, we've used a $2 bill. People think they're very rare, and they are not. People will sometimes send back $2 $1 bills. Sometimes they'll send back $5, so we're making money off the process. But it's just a little incentive, again, for them to take the survey. So then 3 weeks after that, a second wave mailing is sent to them. It comes with all of the same materials that were in the first wave packet, except for the $2 bill. So they only get the $2 bill one time. Then 3 weeks after that, a postcard is sent out, again, just reminding them to please take the survey and return it back to us in 7 days. So that is the mailing portion of it. Then for the Hispanic, Latino, adult, and child data collection, that was a convenient sample, and that was really taken by the helm by the committee during this process. So various organizations within the county collected data from that population at multiple sites. And that data we'll go into later in the presentation. All right. So here we have our results from both the mailing and the convenient sample collection. So you'll see for the adult and for the child, we ended up with 254 adult surveys and 161 child surveys. Now, when we do this research, we calculate a power analysis number based on the population of both adults ages 19 years and over and parents of children ages 0 to 11. We calculate a power analysis number that we'll need to hit to be able to generalize the data to a plus or minus 5 margin of error. Now, this time around, we unfortunately did not hit our power analysis number for either the adult or the child, but we are still happy that we can generalize to a 6.13 and a 7.68 margin of error, respectively. So the data is still generalizable to your county. You just have to maybe use a little bit more caution when interpreting the numbers. And we still ended up with a pretty adequate response rate for adults. At 24% is still about 2 times higher than a national average. And for child at 8%, that's about right in line with what the National Survey of Children Health gets when they do their survey annually. Then for the Hispanic and adult, Hispanic, Latino, adult, and child convenient sample, we ended up with 186 total adult surveys and 156 child surveys. That was phenomenal work in getting those surveys and collecting those. So I just wanted to say to the committee that was a great job, and I know Jamie and I had many a conversation and all of the time, work, and effort that was put into collecting that data. So after the data comes back, we then analyze the data, okay? So we have our statistician analyze the data using SPSS, which is just a beefed up version of Excel. And then we weight the data to reflect population statistics. So let's say, hypothetically, the data came back and it was 60% female, 40% male. But realistically in your county, making this up, it's actually 50-50. Our statistician will weight the data so that it reflects that population within the county. When looking at the limitations, of course, with any type of research, and especially with research done at the community level, there's always going to be limitations. So a lot of the questions, like I had stated before, come from the CDC. Now, the CDC, the Centers for Disease Control and Prevention, when they conduct the survey, they do it via the telephone, okay, while we do a mail survey. So the CDC does not ask questions related to drug use, mental health and suicide, or sexual behavior. And that is just due to the sensitive nature of some of the questions. You know, when they call and ask at dinner time, you know, how often you use cocaine, you're probably not going to get a very good response there. So while we are able to ask those questions on the mail survey, we're not going to have state and national comparison data to be able to compare that to. Also, the data is, of course, self-reported. So a lot of the time, I'll have people say to me, sometimes they'll question the data and say, well, you know, people could have lied. And I say, well, you know, that is always a possibility, right? But I always like to use the example of BMI. So we ask on the survey, you know, how tall and how much they weigh so that we're able to calculate their body mass index. Well, I always like to joke that whenever I go in and I get my driver's license renewed, I will always be 125 pounds because, you know, while the freshman 15 is very real, nobody needs to know that. So I always fib a little bit, like, yes, I am still 125 pounds. And, you know, women do that. And a lot of times men, when they go in to get their driver's license renewed, you know, they always seem to grow an inch or two in their height. So I always like to say that the people in Oregon are just as vain as the people in Maine, as the people in Ohio, as the people in Florida. So while, yes, there may be, people may stretch the truth, or, you know, there may be some inaccuracies there, but again, it's not going to differ that significantly state to state. Lastly, when we're looking at the IRB approval, obviously our entire process goes through our institutional review board. Again, they make sure that we are utilizing good research, that we are not harming anybody in the process of our data collection. They review our methodology, our surveys, and the letters that are sent out to community members. Here, the shaded areas on all 3 state maps are the counties in which HCNO has conducted either community health status assessments or community health improvement plans. As you can see, we are slowly taking over the state of Ohio. And we actually recently just picked up a Northern California county and 2 additional Oregon counties. I want to say it was Modoc, Klamath, and Lake. We just picked them up, and we are doing an opiate assessment there as well. So I always like to say, you know, in the next 10 years, we're going to be the Hospital Council of North America. So if you'll see here on the screen, the website there, hcno.org, we have a tool, and it's called Datalink. And what that is all of the data, all of our core indicators will be uploaded to this service after the community event, so after today. And essentially what you'll be able to do is if you are writing a grant or you want to see how you compare to Morrow or Union, or let's say you're really familiar with some of the Ohio counties or Michigan counties, and you want to see how you compare, you'll be able to go on there and select, you know, a smoker number, the year, the county that you want to compare yourself to, and a graph will pop up that will show those comparisons. And that comes in, again, really handy if you are just looking for, again, regional comparisons, if you are looking at, if you're writing a grant or anything of that nature. Okay. So before we dive into the demographics, does anybody have any questions about the methodology or anything that I just went over? Okay, great. So here, it seems like the other This kind of got all biffed up. But you'll see that this shows the demographics of the survey population. You'll see that 37% of the survey respondents were Hispanic. We did a very nice job capturing that via the mail survey. Here, under marital status, we've got about a little over half of the respondents to the mail survey were married. Here, under education, we have 48%, so nearly half, indicating they had some college or were considered a college graduate. Now, whenever I do these presentations, I always have people saying that just seems a little high, 48% indicating that they were a college graduate. Well, the way that the question was asked, it is essentially somebody would answer that yes, they have had some college or were a college graduate if they even attended college for one day in their life. So again, if an individual said, or if an individual had just gone to college for one day, they would select some college. So keep that in mind. And then here, we have about 30% of those in the income bracket making less than $25,000 a year. Now, throughout a lot of the adult portion of our presentation, we're going to see the largest discrepancy, the largest health inequity there with those individuals making less than $25,000. All right. We will then jump into our first section, healthcare access. And again, please feel free to follow along in the report. And here are the sections that we will be covering. So first, we've got healthcare coverage. So we've got 93% of adults indicating they had healthcare coverage, leaving 7% uninsured. When looking at why adults were without healthcare coverage, on the top response, they lost their job or they changed employers, they could not afford to pay the premiums, or they became ineligible. Here we have our graph and our comparison table. These two items will be in nearly every section as we go through our presentation. So you'll see in the graph, we have our breakdown demographically. So we're going to break down on nearly every question by gender, so male and female, by age, less than 30, 30 to 64, and 65 and over, and then by income. So again, those making less than $25,000 and those making more than $25,000. Then we also have our trend data. So looking at the data from 2011 and 2015. Then in the table below, we are also going to be able to compare it to Oregon and the U.S. And that data comes from the BRFSS. So you'll see we've been on a downward trend since 2011 with your uninsured rate, so that was really nice to see. And of course, those uninsured spiking for those making less than $25,000. Here, we've got our pie chart looking at the sources of healthcare coverage for adults. So you'll see about half, 48%, got their healthcare coverage from their employer. 3% utilized Medicaid or medical assistance. 6% utilized the health insurance marketplace. Moving on to healthcare access and utilization. So we've got 58% of adults visiting a doctor for a routine checkup in the past year. And then almost half reported they had one person they thought of as their personal doctor or healthcare provider. and 51% had visited the emergency room in the past year, with that number increasing to those with an income less than $25,000. We've got 71% of adults leaving the county for healthcare services in the past year. When looking at what they went outside the county for, though, specialty care was the #1 response, tied with dental services, followed by primary care, so those being the top 3 responses. When looking at what might prevent adults from seeing a doctor if they were sick or injured or needed some kind of health care, cost came up as the #1 response, followed by the doctor would not take your insurance, and it was difficult to find an appointment, to get an appointment. Towards the bottom, we had 2% indicating they did not trust or believe doctors, and they found it difficult to find or had no transportation at 1%. When looking at what Umatilla County adults reported as the following as the most important health concerns in their community. So substance or drug abuse and the opioid or other substance abuse were the first 2 responses. The third being the lack of access to mental health care. Towards the bottom, you'll see that diabetes and other chronic diseases, alcohol use, lack of recreation facilities or fitness opportunities were towards the bottom, but still high in percentage. Here we have our breakdown. So looking at those that had a routine checkup, there's been stayed about the same until 2015. Those making less than $25,000, there was a decrease. And those saying that they had one person they thought of as their personal doctor or healthcare provider, about a 2% increase there from 2015, and a little bit lower than Oregon and the U.S. Same for routine checkup, just a little bit lower than, again, the state and nation. Yeah. Nearly half of adults reported they had a flu vaccine in the past year, with that number increasing to those over the age of 65. When looking at why they did not receive the flu shot, they just didn't think they needed it, was the #1 response at 29%. Then it jumps a little bit. So they thought they would get sick from it at 8%. They don't think it works, their religious beliefs. 2% indicating the vaccine wasn't effective. Women's health. We had a little over a third of women reporting they had a mammogram at some time in their life, with 35% having one in the past year. 61% of women over the age of 40 had a mammogram in the past year. 89% of women had a pap smear at some time in their life, and 62% having had one in the past year. You'll see we have our table. So this was interesting for mammogram. There was actually a nice jump from 2015 and higher than both state and nation. Here in Ohio, I am seeing the complete opposite. In all of my counties, there has been a significant decrease for all male and female health screenings, so that was really nice to see. And then for your pap smear, that again decreased slightly. But again, that is still significantly higher than all of my counties that I'm seeing here in Ohio. And I also did want to mention that the way that that we break it down, so ages 40 and older, ages 21 to 65, and the specific years, we do that because that is how the CDC reports that out. However, if you are writing a grant or if you are working with, American Cancer Society or Komen or whomever, and you need the data run a different way, we would be more than happy to run that for you. So if you needed it, women over the age of 50 who had in the past 5 years, we can get that for you because we know that screening guidelines change depending on the organization quite frequently. So that is just how we do it to be able to compare to the state and nation. But if there's any other breakdowns that you guys would need, we can run those for you. Here, women reported the following usual sources for their female health services. So a general or family physician, followed by a private gynecologist. 13% said there were multiple places, including a general physician or a gynecologist. And then 3% said multiple, not including the general physician or a gynecologist. 5% reported they did not have a usual source of care for female health services. Here, for men's health, we've got 39% of males reporting they had a prostate-specific antigen test at some time in their life, with that number increasing to those over the age of 40. And a little over a fifth of Umatilla County males had a digital rectal exam in their lifetime, with 8% having that exam in the past year. Now, when looking at our state and nation comparison, significantly higher than both Oregon and the U.S. for men having a PSA test within the past 2 years, those over the age of 40. And again, same comment that I had for the women's health section. If there's a specific breakdown that you would need to be able to accommodate a grant or research that you're doing, we can run those for you. Oral health. We got 61% of adults having visited a dentist or a dental clinic in the past year, with that number decreasing by nearly 30%, by 30% to 28% of adults with a lower income. When asked why they did not visit a dentist in the past year, cost was the number one response, followed by just they had no reason to go or they hadn't thought of it. 17% said they could not find a dentist who accepted Medicaid or OHP. 7% reported it was fear, apprehension, nervousness, pain, or just a general dislike of going. Here we have our graph. So there's been a little bit of a fluctuation since 2011, a little bit of a decrease from 2015. Big jump to those with a lower income. And here we have our comparison table. So again, those adults visiting a dentist, a little bit lower than Oregon and the U.S. Adults who are reporting having one or more permanent teeth removed, about right in line with Oregon, a little lower than the U.S. percentage. And then those adults over the age of 65 who had all of their permanent teeth removed, a little bit higher than both the state and nation. All right. Any questions or comments regarding healthcare access? I know it's not the most fun data can be a little bit overwhelming. So does anybody have any comments or questions before we move on to the next section? All righty, we will move on then. All right, so health behaviors. So here we have health status perceptions. So we've got 57% of adults having rated their overall health as excellent or very good, 16% rating their overall health as fair or poor. We've got a little over a quarter rating their mental health as not good on 4 or more days, and 22% reporting that poor physical or mental health kept them from doing usual activities such as self-care, work, or recreation. Here we have our graph breakdown. So looking at the trend data, those individuals rating their health as excellent or very good, there was a big jump from 2015. We've got 100% of those under the age of 30 rating their health as excellent or very good. I always like to make the joke that it's the avocado toast. You know, those millennials, they're just living their best lives. Okay. You'll see that those making a lower income were less likely to rate their overall health as excellent or very good. Here we have our comparison table. So when looking at the first 2 rows, those rating their health as excellent or very good, higher than both Oregon and U.S., and those rating their health as fair or poor, lower than Oregon and the U.S. Those are really nice to see. In all of my Ohio counties, those are always the opposite, where those rating their health as excellent or very good is always lower than our state and nation, and fair or poor is always higher. So again, those were really nice to see. Those rating their mental health as not good on 4 or more days, that decreased from 2015. And then those looking at the average days of physical health and the average days that their mental health was not good in the past month, slight increase there for the mental health, but not a huge jump there for those rating their physical health as not good. Here we've got weight status. We have overall 70% of adults were either overweight at 28% or obese at 42%. Again, that is calculated by our statistician using those that reported their height and weight on the survey. When looking at what adults did to lose weight or keep from gaining weight, so they ate less food or fewer calories, they drank more water, they exercised, they ate a low-carb diet. 7% used a program that restricts certain foods or food groups, such as paleo or
keto.
Yes. All right. Here we've got 27% of adults eating 5 or more servings of fruits and veggies per day, 40% eating 3 to 4 servings, 32% eating 1 to 2, and 1% eating 0. That I know that was actually on the lower end of what I've seen. Typically for those eating 0 servings per day, in a lot of my Ohio counties, I'm looking at 6 to 8%. So that was very nice to see that just 1%, or I'm sorry, that just 1% were eating 0 servings. And then when looking at where they purchased their fruits and vegetables, so a local grocery store at 94%, so most got their fruits and vegetables from a local grocery store. A little over a third got them from a farmer's market. 26% grew their own or they gardened. 19% got them from a produce stand. So those were all very nice and floated to the top. Typically, farmers market, they grow their own produce stand. Those do not come up in the top responses here in Ohio. So that was also a nice, pleasant surprise when writing your report. Here we're looking at the physical activity. So this was actually a question that your committee created. It has been really popular here with a lot of my other counties. So we broke it down by asking about different types of physical activity. So light intensity, moderate intensity, and then vigorous intensity physical activity. And I included examples of how we asked it on the questionnaire. So we have 96% of adults reporting they engaged in light intensity physical activity in the past week, 83% engaging in moderate intensity physical activity, and a little over half engaging in vigorous intensity physical activity. 4% reported they did not participate in any physical activity, including 1% who were unable to exercise. Again, that was a nice low percentage. Typically, that percentage is in the 20 to 25% range of those not participating in any physical activity. All right. When asked what would help them use community bikes or bike trails, parks, and walking paths more frequently, a little over a third indicated if there were just more available parks and bike trails and walking paths, if there was better promotion and advertising of existing parks, designated safe routes, improvements to existing parks, more public events and programs involving parks, trails, and paths, or easier access overall to walking and bike trails. Again, here we have our graph breakdown. And then we have our comparison table. So our overweight was nice. It decreased. But what probably happened was they just jumped a category into obese. If you're obese, that increased significantly from 37 to 42%. And we're quite higher than Oregon and US there. When looking at our breakdowns at the top in the graph, those making less money, so those making less than $25,000 a year, were more likely to be considered obese. Moving on to tobacco use. So we've got 8% of all adults were current smokers, 20% were former smokers, and then when looking at the frequency of when Umatilla County adults used chewing tobacco, snuff, or snuff, 4% reported it was every day, 5% reported some days, and then 91% didn't use it at all. Here in our comparison graph, or in our comparison table, your current smoker number was nearly cut in half. That's probably one of the lowest adult current smoker numbers I've seen. And your former smoker also went down, and both indicators are lower than Oregon and US. When looking at what types of tobacco products were used by adults in the past year, cigarettes was the #1 response, followed by chewing tobacco. You'll see that only 3% used e-cigarettes or vape pens. That's also on the lower end of what I'm typically seeing in my adult population in my other counties. Typically, that percentage is in the 6 to 7% range, and of course, that jumps up significantly with the youth, with that percentage being in the 13 to 17% range. So overall, that was on the lower end. We have 7% of adults indicating they used more than one type of tobacco product in the past year. And here we have our actual graph. So you'll see under those under the age of 30, 78% indicating they never smoked. So that was a nice high percentage. And then when looking at current smokers, it was interesting that those under the 30 were also more likely to be current smokers. And then when looking at the income comparisons, those with a lower income were more likely to be current smokers than those compared to those with a higher income. All right, here we've got alcohol consumption. We've got 54% of adults indicating they had at least one alcoholic drink in the past month or in the past 30 days. 20% of all adults were binge drinkers, and the way that we define that is those individuals consuming 4 or more if they are a woman, or 5 or more drinks if they are men on a single occasion in the past month. Okay, so when looking at of those current drinkers, so of those who drank in the past month, how many of those were binge drinkers? We got 39%. Okay, and then when looking at how many drinks they consumed on average, that was about 3.6 drinks. Five percent of current drinkers reported driving a motor vehicle such as a car, truck, or motorcycle within a couple hours after having 3 or more drinks, with that number increasing to males. And then 14% of current drinkers reported drinking alcohol while on prescription medication, with that number increasing to those over the age of 65. Right. Here we have our graph looking at the average number of days drinking alcohol in the past month. So when looking at those making drinking on 3 or more days, this is one of the few data points where we're going to see that percentage jump for those making a higher income. So those making more than $25,000 were more likely to be a frequent drinker. And moving on to drug use. So before we jump into this data, I did just want to say that as we're going through the specific drug use data, a lot of it is realistically going to be underreported. So in the beginning of the presentation, when I was talking about the limitations to the data collection, and that one of those is the way the CDC asked the question. And the CDC does not ask about drug use. So while we do ask about drug use, it is still tricky to get an accurate portrayal of drug use in a community via a mail survey. So I always like to use the example that because it is a mail survey, if you want to have somebody who is a substance abuser or is a drug addict, and the odds of those individuals having a home or a home address are pretty slim to begin with. Then for them to receive the survey, open it, take it coherently, the 16 pages, fold it in half, put it back into the envelope, and mail it back to me, it's probably not going to happen. So in addition to having our drug use data, there is also some secondary data within this report that can supplement that as well. And of course, there are other experts in your community that, can also provide some insight into this topic as well. And with a lot of the questions that we ask, not only do we ask, do you, abuse or misuse or however it's worded, but we also like to incorporate, have you or a family member experienced the following? So while for a lot of the questions we may not be able to get those directly affected or that are currently in a situation where they are a substance abuser, abusing drugs, we're able to get insight into those that know or have a loved one that is going through something like that. So I just wanted to preface that before we jump into this data. So when looking at our first data point here, we've got 17% of adults reporting they had used medication not prescribed to them, or they took more than prescribed to feel good or high or more active alert in the past 6 months. When looking at those adults who misuse prescription medication, they had obtained their medication from the following places. So most got their medication from a primary care physician, followed by multiple doctors, or free from a friend or family member. 2% reported it was an ER or urgent care doctor, and 2% had bought them from a friend or family member. Here we have our graph for medication or prescription medication misuse. So it's been on an increase since 2011. You'll see that that percentage jumped to those under the age of 30 and those females, and those with an income less than $25,000. One percent of adults reported using other recreational drugs such as cocaine, synthetic marijuana, heroin, LSD inhalants, ecstasy, bath salts, and methamphetamines in the past 6 months. And then here again we have our comparison table. So those misusing prescription drugs, again, has been on the slight increase since 2011. And then those using recreational drugs and those who used heroin, there was no change. Here, this question looks at statements regarding substance abuse and whether individuals taking the surveys agreed or strongly agreed with these statements. This was a new question that was put just on your community level survey. So the first response here, we've got 75% reporting that they agreed or strongly agreed that most employers will pass over the application of someone who has been treated for substance use in favor of another applicant. We got 68% reporting most people think less of a person who has been in treatment for substance use. A little over half of people would be willing to date someone who has been treated for substance use. And 55% reported that most employers will hire someone who has been treated for substance use if he or she is qualified for the job. And then there are several other indicators within your the health assessment document for this question. It just wouldn't all fit on the slide. All right. Here we have marijuana use. So we've got 12% of adults had used marijuana in the past month, with that number increasing to males. Been on a slight increase since 2011. And this was interesting. It jumped up to those also making a higher income. So those making more than $25,000 were more likely than those making a lower income to have used marijuana in the past month. Adults had used marijuana on an average of 2.2 days in the past 30 days. And then of those who used marijuana, they used the following types. So most, about 88%, had used recreational marijuana, followed by medicinal marijuana at 27%, and other products with THC oil. And then when looking at how they used it, most, 76%, smoked it, they ate it, dabbed it, vaporized it. 3% had drank it, and then 5% used it in other ways. All right, so sexual behavior. Again, similar preface to what I had discussed with drug use. The CDC does not ask these questions due to the sensitive nature of the questions. And we always get the most fascinating responses when surveys come back in the mail. People are just very, very honest and sometimes provide more information than what we asked. So we have 70% of adults reporting they had had sexual intercourse in the past year, with 1% having had intercourse with more than one partner. That number slightly decreased from 2015. 55% of adults had unprotected sexual intercourse in the past year, with that number increasing to males. When looking at what types of birth control adults had used, condoms was the #1 response at 11%, followed by an IUD or using shots. 4% used the withdrawal method, 3% used the birth control pill, 2% were practicing abstinence, 15% did not use any method, and 8% had been forced or pressured into any form of sexual activity when they did not want to, with that number increasing to females and those with a lower income. Of those forced or pressured into sexual activity, 5% reported it.
Is there a typo in the data on that? 3% birth control pills, is there like another number that's supposed to be in front of the 3?
Well, let me look here.
And no method, that's all ages?
Yep, only 3% used the birth control pill, and yes, that is all ages.
Not people, well.
What was that?
Well, yeah. I mean, in an older population, you would expect you would take out people who were not at risk to pregnancy. You want to know what levels of birth control, don't you think?
And I can, so this would be out of all adults. If you want, I can run the data of those in a specific population. That just isn't the way that we typically run it to incorporate in the report. And again, we do try and weight the data to, reflect population statistics for gender, age, income, race. Get with Jamie if there's anything that you would like to see ran a different way, and I can provide those for you. We will move on.
I have a quick question.
Sure.
So when you're looking at the Umatilla County adults number of sexual partners in the past year, under 30, it says 0%.
Yeah.
How did we ask that question in the past? Because here it says respondents were asked during the past 12 months with how many different people have you had sexual intercourse. It almost looks as if they're not having sexual intercourse, but enrollment in Head Start would beg to differ. So I want to make sure that we're actually it's actually reporting that they're not having sexual relations with anybody different.
Yeah, so you bring up a very good point, and this would fall under the limitation of the survey. So historically, when we've done our surveys via the mail, we've always had a better response with an older population, right? So we've always had more people over the age of 65 take our survey. That's just the nature of that population. Not only, we've had a lot of trouble reaching the population of those under the age of 30, and specifically in the last 3 to 4 years, we've been seeing that. And not only are we seeing it locally, researchers at the national level are also seeing that that is a very difficult group to reach. Not only is it because this population, those under the age of 30, are either don't have a home address, or they live with their parents. That is just kind of the trend recently at the national level. In addition, a lot of the times the younger population is also an extremely transient population, and they don't stay at one place in one time, which makes it very, very difficult to reach them. In addition, they don't really like taking paper and pen surveys, and we tried to pilot a online version of the survey with specifically that population, and that was also difficult to reach them as well. So we realize that is a limitation, And in fact, we probably only got, when you're looking at, in the back of the report, we have a sample demographic profile where we break down the demographics of the survey and how many people from each age group responded to the survey. And I want to say we did have a low number of people in that age group respond, which leads to maybe some of the questionable percentages that you kind of, you know, as an expert in your field, you're like, this doesn't really add up with what I'm seeing. But again, when we're looking at the data and we break down any total numbers, you always kind of have to use that data with caution, right? So while we do our best to weight the data to account for any significant differences, you know, when looking at the data and when doing research, you do have to recognize that there is just going to be some limitations there. So I hope that answers your question.
Well, it does, and it better responds to the under 30 in regards to, you know, your avocado toast and adult health perception. Is,
Yes.
you know, in under reporting on that as well.
Yeah.
Yeah, I mean, so what's the confidence interval around the estimates for the under 30 population? There were only 14 responses, and so the confidence interval must be quite large.
I don't have that number off the top of my head,
So
but I would agree with you. It is probably quite large, yes.
Yeah, right. But there's no indication of that in the report, so it's a little bit confusing.
It is in the executive summary. We do list that as a limitation, that age group did have that X number of responses that replied. So that is listed there as a limitation, and just to use that data with caution.
In every single table?
No, not in every single page. We do on every single page underneath each graph where we have our breakdown. It is indicated that, you know, to use that data with caution. When interpreting a subgroup results, as the margin of error for any subgroup is usually higher than that total percentage. So that is listed underneath every single one. And in the executive summary of the health assessment, under the limitation section, it does list that, you know, unfortunately, only X amount of people under the age of 30 replied, and again, to use that with caution.
No, well, yeah, and the problem is most people aren't used to reading statistical reports, and so they gloss over that stuff.
Sure.
It's, you know, anyway.
I think the thing that concerned me when I saw this is that when I add up using different methods, and then I add in the percentage that don't use anything, it still only comes up to about 50%. So where's the rest of the people doing?
They might not have responded.
It's non-responsive.
Or they didn't respond, okay.
Correct.
Didn't respond.
Great. Any other questions or comments before we move on?
They should put non-response.
All righty. Again, here we have our graph breakdown, which we just went over. All right, so for mental health, again, very similar to both the drug use and the sexual behavior section. This is likely also underreported, just due to the sensitive nature of the questions. So we have 2% of adults considered attempting suicide in the past year, with 2% actually reporting, or I'm sorry, attempting suicide. When looking at where adults received the social and emotional support they needed, they received it from the following. So friends and family came in at the #1 response at 76%, followed by God and prayer and church were the top 3. 4% indicated it was their community. 7% of adults reported they did not get the social and emotional support that they needed. And 18% reported they did not need support at all. Okay. When looking at how adults dealt with stress, so they talked to someone that they trusted, they ate more or less than normal, they worked on a hobby, they participated in prayer and meditation. Towards the bottom, we've got some of the more riskier behaviors. So 17% drank alcohol, 8% had used marijuana, 7% took it out on others. And then here, this lists the disorders that adults reported that they or their family were diagnosed with or treated for. So anxiety and emotional problems and depression or a specific anxiety disorder were the first three responses, followed by a bipolar disorder, alcohol or illicit drug abuse. All right. So before we move on to chronic disease, does anybody have any additional questions or comments regarding the health behavior section? All righty, we will move on then. So here under cardiovascular health, we have 4% of adults indicating they had survived a heart attack, 3% reporting they survived a stroke, and 2% reporting they had angina or coronary heart disease. All of those indicators increased to those over the age of 65. We have 26% of adults having been diagnosed with high blood pressure. 5% were told they 29% had been diagnosed with high blood cholesterol, and 66% had their blood cholesterol checked within the past 5 years. Here, this graph lays out the Umatilla County risk factors for cardiovascular disease. So this looks at obesity, high blood cholesterol, high blood pressure, diabetes, and smoking, and their corresponding percentages. And here we have our comparison table looking at how the county data compares to the state and nation. So for the angina, coronary heart disease, heart attack, both decreases there. Stroke, a little bit of an increase since 2015. High blood pressure, high blood cholesterol, both decreased. And those that had the high blood cholesterol checked, a little bit of a decrease from 2015 and both lower than the state and nation. Here we have our cancer. We did not ask any primary data, so we didn't ask a cancer question on the questionnaire. So I just included this cancer mortality rates from CDC Wonder from 2015 to 2017, looking at lung and bronchus and colon and rectum being the two most common types of cancer that individuals passed away from. For asthma, there was a big decrease here since 2015. 7% of adults have been diagnosed with asthma, with that number increasing to those with a lower income. And 6% of adults with asthma had visited an emergency room or an urgent care because of their asthma in the past year. For arthritis, we have 34% of adults having been diagnosed with arthritis, with that number increasing to those over the age of 65. 85% of adults that had been diagnosed with arthritis were also overweight or obese. You'll see that number decreased slightly from 2015, but we're still higher than the state and nation. For diabetes, we have 9% of adults indicating they were diagnosed with diabetes, with that number increasing to those over the age of 65. 3% were diagnosed with prediabetes or borderline diabetes. Diabetics also had one or more of the following characteristics or conditions. So they were more likely to be overweight or obese, be diagnosed with high blood cholesterol, and be diagnosed with high blood pressure. So looking at what diabetics were using to treat their diabetes, so the first couple responses, so they checked their blood sugar, they were checking their A1C annually, they were checking their feet, they were taking diabetes pills, and participating in a 6-month checkup with their provider. 67% were controlling their diet. That was a nice high percentage with what I typically see. 32% were exercising, 25% were using insulin. Here, there was a nice decrease from 2015 for those adults diagnosed with diabetes. Again, a little bit higher for those with a lower income. And then same for those ever having been diagnosed with prediabetes. There was a slight decrease from 2015. Looking at quality of life, we have 28% of adults reported they were limited in some way because of a physical, mental, or emotional problem, with that number increasing to 58% of those with a lower income. Here, this graph looks at the most limiting health problems. So back or neck problems, arthritis, chronic pain, walking problems, and fractures, bone, and joint injuries were the top 5 responses there. Here, this looks at the following that adults were responsible for providing regular care or assistance to. So about a quarter reported that they provided regular care to multiple children, a friend, family member, or spouse who has a health problem. 3% indicated it was a friend, family member, or spouse with a mental health issue, and 1% indicated it was a friend, family member, or spouse with dementia or memory loss. 1% reported they took care of foster children. Great. I know we went through that a little quickly, but any questions or comments regarding chronic disease before we move on to social conditions? All righty. So here, under the social determinants of health, we have 16% of adults reported that they needed help with their general daily needs. That included food, clothing, shelter, or paying utility bills. That increased to 55% of those with a lower income. You'll see that there was a slight decrease, or I'm sorry, a bit of a jump from 2015 for those that needed help with their general daily needs. Here, we've got 22% of adults reporting they experienced at least one issue related to hunger or food insecurity. They experienced the following. So they had to choose between paying bills and buying their food. They went hungry or ate less to provide more food for their family. They worried their food might run out. Their food assistance was cut. They did not eat because they did not have enough money for food. And their loss of income led to food insecurity issues. We have about 1 in 9 adults experiencing more than one issue related to hunger or food insecurity. Here, this looks at where adults attempted to get help from the following social service agencies. So we've got the DHS, your self-sufficiency at 8%, a friend or a family member, WIC, and the Area Agency on Aging. Towards the bottom, we've got 2% going to Connections or Good Shepherd Healthcare System, 2% went to Marisol, 2% went to the Health Department. Here, this looks at the adverse childhood experiences, and we have the following. So about 33% reported that their parents became separated or were divorced, that they lived with someone who's a problem drinker or alcoholic, a parent or adult in their home swore at, insulted, or put them down, and they lived with someone who's depressed, mentally ill, or suicidal. We got 20% of adults experiencing 4 or more ACEs, with that number increasing to 52% of those with an income less than $25,000. Here we have our graph breakdown. So this is always fascinating. Again, that jumped up for those with a lower income and for females. And we use 4 or more for ACEs, so the adverse childhood experiences. That is just a standard of what is used when we classify that by adult. When we get to the child data, we break that down by the child experiencing 2 or more ACEs in their lifetime. All right. Here we have our table looking at some risky behaviors and other data points, comparing those individuals who experienced 4 or more ACEs versus those that did not experience any. So you'll see that those individuals classified as obese had experienced 4 or more ACEs. Those binge drinkers, current smokers, those that had considered attempting suicide, and those that had used recreational drugs in the past 6 months, all were more likely or had experienced 4 or more ACEs, those when compared to those that did not experience any. We have nearly half of adults reporting they kept a firearm in or around their home, 8% reporting they were unlocked and loaded, so a slight decrease from 2015. And again, this is going to be one of the only data points where we're going to see that jump up to those with an income higher than $25,000. We have 4% of adults reporting they were threatened or abused in the past year. 45% were abused by a spouse or partner, followed by a child, another family member in the household. 9% reported it was someone outside their home. We're looking at those who were abused. They were abused in the following ways. So emotionally was the number 1 type of abuse, followed by verbal, financial, and through electronic methods. So looking at environmental health, we're looking at what adults thought threatened their health or their family members' health in the past year. The outdoor air quality was the number 1 response at 27%, followed by the agricultural chemicals. 5% said mold and moisture issues. All right. So any questions about social determinants, the social conditions, or any of the other previous data that we had gone over before we jump into the Hispanic and Latino health? Okay. Like I had said at the beginning of the report, the following data for the Hispanic and Latino, this is just going to cover the Hispanic Latino adult health. We will cover the child health after we cover the after we cover this. This was collected via convenient sampling. We ended up with 186 Latino and Hispanic surveys. So here under the healthcare access, coverage, and utilization, you'll see that 56% of Hispanic Latino adults reported they had healthcare coverage compared to, that they did not have healthcare coverage compared to 7% of the general population. When looking at what Hispanic Latino adults used the following types of healthcare coverage. So employer, followed by Medicare, someone else's employer, 8% used Medicaid, 5% used the health insurance marketplace.
Employer 31%. That's 31% of 44%, correct?
Correct, yes.
That's of those who had health care coverage.
Yes. Yes.
31% was employer-based. Yeah, the wording's okay.
Oh, I apologize for that. Yes, it's of those that had health insurance. Yes.
Yep.
Here we have 59% of adults having gone to a doctor for a routine checkup in the past year, compared to 58% to the general population, so not a huge discrepancy. We have 48% of adults reported having a usual source of medical care. Reasons for not having a usual source included the following. They didn't have insurance. They didn't need a doctor. They couldn't afford it. 4% did not like, trust, or believe in doctors. 2% did not know where to go. We have 53% of Hispanic Latino adults in the county having used the emergency room in the past year, compared to 51% of the general population, so slightly more likely. And then 42% of Hispanic Latino adults went outside of the county for healthcare services. That is compared to, and I don't have it on the slide, but that was 71% of the general county having gone outside the county. So this was less. And then looking at what they went outside the county for, specialty care and dental care, those mirror the general findings from the previous section that we had gone over. And then looking at what they reported as the most important health concerns in their community, diabetes and other chronic disease was the #1 response at 32%, followed by alcohol use and depression. Here, this adult comparison table is a little bit different than the comparison tables that we had gone over for the general adult. So our comparison data from 2012 and 2015 is a little different, okay? Some of the data collection for this population differed, so that could explain some of the discrepancies between a lot of the percentages. And in 2015, we collected data from this population in both Umatilla and Morrow County. So that was a combined health assessment. So here again, for uninsured, that 2018 Hispanic Latino data, again, significantly higher than the general county. And then those adults that had visited the dentist or dental clinic in the past year, again, Hispanic Latino adults less likely than that total Umatilla County 2018 percentage. Here we're going to move on to health behaviors and chronic disease. So the Hispanic Latino adults, they were more likely to have been diagnosed with diabetes and asthma, 15% compared to 9% for diabetes, 11% compared to 7% to the general population. Generally, when we write these sections just as a preface, if there isn't more than a about a 5% difference. We try not to include it. There may be some that were just maybe too significant, or items that we talked about previously at the rough draft meeting, but typically we only provided it or only included it in the report if there was that much of a significance within the percentage. Here under the second bullet, we've got Hispanic and Latino adults were less likely to have been diagnosed with high blood pressure, high blood cholesterol, and arthritis. They were more likely than the general population to have had 2 or more sexual partners, to have had a digital rectal exam in the past year, to have rated their health as fair or poor, to have used marijuana in the past month, been forced to have sexual intercourse when they did not want to, and be overweight or obese. They were less likely to have received a seasonal flu vaccine, to have rated their health as excellent or very good, to be considered a current drinker, and then to have had their blood cholesterol checked in the past 5 years. And they were equally as likely to be a current smoker. Again, we have our comparison table. So less likely again to be a current drinker, at 31% compared to 54%. More likely to be diagnosed with asthma at 11% to 7%. Any questions on the health behaviors and chronic disease before we move on? All right. Here for social conditions, Hispanic Latino adults were more likely to have experienced 1 or more issues related to hunger or food insecurity. That was 34% of Hispanic Latinos compared to 22% of the general population. They were more likely to have been threatened or abused in the past year, 31% compared to 4% of the general population. Drink an alcoholic beverage while driving, and they needed help meeting the general daily needs, 20% compared to 16% of the general population. Hispanic Latino adults were less likely to have a firearm in or around their home, and experience 4 or more ACEs in their lifetime, with 11% compared to 20% of the general population. Okay. Any overall questions about the Hispanic or Latino data? So moving on here to child health. So this first portion, this was actually the child data similar to the first portion of the adult data that we went through. This was sent out to 2,400 parents of children ages 0 to 11 years old, and was collected and analyzed very similar to the adult data. And we will be going over these sections listed here on the screen. So here under health and functional status, we have 88% of parents rating their child's health as excellent or very good. We have 25% of children being classified as obese by BMI. 15% were classified as overweight. Almost a third of children ate 5 or more servings of fruits and or vegetables per day. 5% eating 0. Parents had reported that a doctor had told them that their 0 to 11-year-old child had the following conditions. So a speech or language delay, asthma, and anxiety problems were the top 3, followed by dental problems and ADD or ADHD. Towards the bottom of the list, 1% reported it was autism or ASD, and a brain injury, concussion, or head injury. 1% reported that their child was diagnosed with depression. Here we have our graph. Again, this is different than the graph that we had gone over in the adult section of the report. So we break it down by our total Umatilla County percentage for children ages 0 to 5 and 6 to 11. We break it down because that is how the National Survey of Children's Health breaks it down for both Oregon and the U.S. So you'll see here that those ages 0 to 5 of Umatilla County children less likely to be diagnosed with asthma, and those children ages 6 to 11 about the same as the state number and lower than the U.S. percentage. And then we have 3% of parents reporting their child ages 0 to 11 had experienced an episode of asthma or had an asthma attack during the past year. And then no parent reported that their child stayed overnight in a hospital because of their asthma. 9% reported their child had an emotional, developmental, or behavioral problem that required treatment and counseling, with that number also increasing to those with a lower income. 16% reported their child had difficulties in at least one of the following areas. So emotions and moods or concentration. 4% indicated it was their behavior, and 3% it was being able to get along with people. %, of children had been to the dentist in the past year, with that number decreasing to those children or to those parents with an income less than $25,000. Now, looking at what problems parents reported their child had with their teeth, cavities was the #1 response at 24%, followed by crooked teeth or teeth that needed braces. Overall hygiene at 8%. Towards the bottom, enamel problems, family history of dental problems, gum problems, discoloration or pain, all at 1%. Here I know this is an awfully big comparison table, but again, we're looking at, again, it splits it. So we have our Umatilla County 2018 data for those ages 0 to 5 and 6 to 11, corresponding in comparison to the Oregon and U.S. percentages, again, for those ages 0 to 5 and those ages 6 to 11. So just pointing out a couple, those children or parents who rated their health as excellent or very good, their child's health, both lower than the state and nation for both age groups. Those ages 6 to 11-year-olds were more likely than the state and nation to go to the dentist. Moving on to healthcare access. So 6% of Umatilla County parents reported that their child did not have health insurance in the past year. 5% reported their child was covered but had a gap in coverage. 89% reported their child was covered the entire year. When looking at what types of health insurance their child was covered by, insurance through a current or former employer at 78%, followed by the Medicaid, OHP, or state children's health insurance program. 2% indicated it was self-paid, 1% reported Medicare, 3% indicated it was some other source of insurance. %of parents reported they had one or more people they think of as their child's personal doctor, with that number decreasing to those with a lower income. 80% had visited their healthcare provider for preventive care in the past year. Most parents reported their child had one particular place they usually went. They were sick or needed advice about their health. And then 14% reported they had problems paying or were unable to pay for any of their child's medical bills, with that number increasing, again, to those with a lower income. This is a new question that was created by the committee. So in the past year, 5% of parents reported they had utilized telemedicine or virtual care for their child. Of those who did not utilize telemedicine or virtual care, they reported the following reasons why. So simply their child didn't need it. They hadn't heard of it at 28%. 5% did not trust the quality of care. 4% didn't have access to it. 1% indicated it was cost. Here we have our comparison table for healthcare access, again, breaking it down by the two age groups. So those having been to a doctor for preventive care, for those ages 0 to 5, about right in line with Oregon and the U.S. For those ages 6 to 11, a little bit lower than the state and nation. Parents indicating their child had a personal doctor or nurse. The county data for both 0 to 5 and 6 to 11, higher than the state and nation. Family reported having problems paying for their child's medical or health care bills. Both age groups higher than the state and nation. And then same for the child receiving treatment or counseling from a mental health professional in the past year. For 0 to 5, higher than both Oregon and the U.S. And then for the 6 to 11-year-olds, right in line but slightly higher than the state and the nation. Here, we're just going to look at early childhood data. So this is specific to just those children ages 0 to 5. So we're looking at what mothers did during their last pregnancy with their 0 to 5-year-olds. We have 88% taking a multivitamin with folic acid, 83% receiving prenatal care within the first 3 months, 65% receiving a dental exam, then followed by receiving WIC services. About a quarter experiencing depression during or after pregnancy, 4% smoking cigarettes or other tobacco products and using marijuana, 2% experiencing domestic violence. 60% of parents reported they had children who were fewer than 18 months apart. That looks at that birth spacing issue. Parents reported that they put their child or infant to sleep. So 89% sat on their back, 7% sat on their side, 2% indicated it was on their stomach, and that they did not know. And then looking at where children were put to sleep, 62% were put to sleep in a crib or bassinet without a bumper, blankets, or stuffed animals. 59% indicated it was in bed with them or another person. 55% indicated it was a pack and play. We have 26% indicating a swing in a car seat, 24%, so about a quarter, saying it was a crib or bassinet with a bumper, blankets, and stuffed animals. And then the last two responses there, looking at the floor and a couch or chair. looking at the frequency at which they breastfed their child. So 21% said they breastfed their child less than 3 months. We have 22% indicating it was more than 1 year, 6% indicating they never breastfed. And here we have our comparison. 6% indicating, again, they never breastfed their child, lower than both Oregon and the U.S. And then looking at a parent or family member reading to their child every day in the past week, a little bit lower than the state number, right in line with the U.S. percentage. Here we're going to look at the middle childhood data. So this is specifically looking at those children ages 6 to 11. We've got 95% of parents definitely or somewhat agreed that their child was safe at school. 5% of parents somewhat disagreed. 39% felt their child was not safe at school. When looking at the reasons why, fear of bullying, gun violence, or an active shooter, they were afraid of kids who show unusual behavior, were the top 3 responses. When looking at what parents discussed with their 6 to 11-year-old child in the past year, so screen time, eating habits, bullying and violence, gun safety, water safety were the top responses. Towards the bottom, we've got 58% discussing body image, 53% the negative effects of alcohol, 2% did not discuss any of these topics with their child. 47% reported their child was bullied in the past year. About a third reported they were verbally bullied. 11% said physically, 8% indicated they were indirectly bullied, and 1% reported they were cyberbullied. 14% of parents reported their 6 to 11-year-old had a social media or virtual network account. Of those who had an account, they reported the following. So 86% had their child's password. A little over half said their child's account was checked private, and exactly half knew all of their people and their child's friends. Okay. Here we have our comparison table. So child did not miss any days of school because of an illness or injury, lower than both Oregon and the U.S. And then looking at the parent definitely agreeing that their child was safe at school, lower than both Oregon and the U.S. Okay. Here we're looking at family and community characteristics. So we have 45% of parents reporting that every family member in the household ate a meal together every day of the week, and parents reported that their child got the following amounts of sleep. So 8 hours or less at 23%, 22% indicating their child received 11 hours or more. In the past year, 3% of parents reported it was often that they worried whether food would run out before they got money to buy more. 15% said it was sometimes true, 82% said it was never true. And then 3% of parents also reported it was often true that the food they bought did not last and did not have money to buy more. Again, 10% said it was sometimes true, and 85% said it was never true. These 2 bullets, these were 2 additional questions that were created specifically for your guys' survey. Okay. Here we have the child ACEs. So 13% of parents reported that the child's parents became separated or were divorced. The child lived with someone who was mentally ill, suicidal, or severely depressed. Lived with someone who had a problem with alcohol or drugs. Parent or guardian served time in jail. or they were treated or judged unfairly because of his or her ethnic group. 4% of children experienced 2 or more ACEs. In the past year, parents reported that someone in their household received the following: a free or reduced cost breakfast or lunches at school, benefits from the WIC program, SNAP or food stamps, mental health treatment at 9%, cash assistance from a state or county welfare program. Here, this looks at more of the safety characteristics and looking at how the child was put into a vehicle and what was used. So you'll see that 87% of parents reported their child up to five who met the weight and or height limits always rode in a car seat when a passenger in the car. 64% reported their child was under 4'9", always rode in a booster seat, compared to 17% who never rode in a booster seat. And 65% of parents whose child was old enough and or tall enough to not be in a booster seat reported their child always wore a seatbelt. 18% reported their child never wore a seatbelt. Here we have our comparisons again. So looking at the family that eats a meal together every day of the week, looking at that 0 to 5 percentage, lower than the Oregon and US number. That 6 to 11 number, though, was higher than the state. And then those that experienced 2 or more adverse childhood experiences, both the 0 to 5 and 6 to 11 were lower than the state and nation. Here, parent health. We have 69% of parents rating their physical health as excellent or very good, 2% of parents rating their physical health as fair or poor, and then 68% of parents rating their mental and emotional health as excellent or very good, and 5% rating their mental and emotional health as fair or poor. Again, our comparison table. So when looking at specifically the mother's mental and emotional health, both 0 to 5 and 6 to 11, higher than the state and nation, where the father's for 0 to 5-year-olds was lower than the Oregon and the US number, and slightly higher than the state and nation number for 6 to 11-year-olds. Here, we have 14% of parents indicating they were uninsured, with that number increasing to those parents with a lower income. And then parents had missed work due to the following. So their child's illness or injury, the child's medical appointments were the top 2 responses, followed by lack of or unreliable child care, the child's asthma, the child's behavioral and or emotional problems, their child was bullied, or their child was suspended from school. Great. Any overall questions for the child data that was collected via the mailing before we move on to the Hispanic Latino child health section? We're almost there, guys. I know this is a lot of data. All right, we will move on. So again, this data was collected via convenient sampling. There were a total of 156 child surveys that were collected. And again, the effort was made to collect the data in the similar age groups of those children ages 0 to 11. All right. So we have here Hispanic Latino children were more likely to have been diagnosed with mental problems or ADD or ADHD
Tessa, can you hear us?
We lost your audio.
Yeah,
We can't hear you right now.
There you go.
there you are.
You're back.
Oh, you can hear me?
Yep.
Yeah, we can hear you.
Okay, yay. All right. So, you'll see that Hispanic and Latino children, they were equally as likely to be diagnosed with anxiety problems at 8%, and they were more likely to have more than one type of health condition, 16% compared to 11% of the general population. They were more likely to be uninsured, so 10% compared to 6% of the general population, and they were more likely to have ever been enrolled in the Oregon Health Plan or Medicaid, / Medicaid, 74% compared to 29% of the general population. They were less likely to have ate 5 or more servings of fruits and or vegetables per day, 12% compared to 30% of the general population, and they were less likely to have gone to the dentist in the past year, 61% compared to 80% of the general population. Hispanic and Latino parents were more likely to have had problems paying or were unable to pay for their child's medical bills, 17% compared to 14% of the general population. More likely to receive a home visit from a nurse, healthcare worker, social worker, or other professional, 14% compared to 7%. And then they were more likely to worry food would run out before they got money to buy more in the past year, 14% compared to 3% of the general population. Parents, again, were less likely to report that their child's personal doctor or nurse always explained things in a way that they could understand, 53% compared to 72% of the general population. They were less likely to have one or more people they think of as their child's personal doctor or nurse, and they were less likely to have rated their child's health as excellent or very good, with only 73% rating their health as excellent or very good compared to 88% of the general population. Okay. So that concludes the presentation aspect of it. We covered a lot of data. I can't really see you that well, but I'm sure all your eyes are completely glazed over. So before we go into the participant feedback questions, does anybody have any additional questions or comments that you would like to share before we go into the questions and then report out there?
So Tessa, I wanted to jump in right here before we do the question comment section.
Sure.
This is a ton of data, and you probably need some time to look over this report and actually pull out the things that you think are important. Where we go from here as Good Shepherd is going to make a community health improvement plan. But as a partner with other organizations, we're going to set strategies and objectives to tackle some of these health issues. If you look on the back cover of your report, these are the selected health priorities that we pulled out of that data. If you are interested in working on strategies and objectives to tackle that, we're having a meeting on this Friday at St. Anthony Hospital in the boardroom at 10:45 to create strategies and objectives for that. If you can't make that meeting, you can always be involved in the Healthy Communities Coalition or Safe Communities subcommittee here at the hospital. And the information for that is in our health ed brochure. So make sure that you check that out before you leave. And please fill out the stakeholder perception sheet before you leave and make sure that you set it in the center of your table. So Tessa, I'll turn it back to you.
Yes, perfect. So yes, please complete that before you go, because Jamie will then collect those at the end, and then those will be typed up and incorporated as an appendix within the CHA document. You'll have time to complete that as we got done with the presentation a little early. But so as you guys are completing that, I just kind of wanted to, and anybody can answer these, just to, just first reactions to the data. So I'll just kind of go question by question. So for the first one, what surprised you the most? And anybody can speak up as to what surprised you the most in regards to the presentation and the data. And I know we covered a lot, but trust me, there's way more data within the actual health assessment that we did not cover. So what surprised you guys the most?
And just to be clear, we don't have a microphone that we're passing around. You can just go ahead and speak up, and Tessa can hear you because there are microphones that are different.
Yeah.
One of the things that surprised me was the low percentage that it said were enrolled in Medicaid, and that there was such a high percentage of uninsured for under 25,000 in income. That doesn't make any sense.
You're looking at the adults though,
Yeah, but
versus the children.
No, but
a
no, I
third
know
of the
that.
county's on OHP.
But a lot of them don't, a lot of the lower income aren't citizens. They don't qualify for OHP. So they're working and they're making money, but they do not qualify for OHP.
But
We see
that
that
if
a
a
lot.
third of the county, we know from OHP data that a third of the county's on there.
Yeah.
So that at least a third of the county should have reported that they're on OHP.
But that includes children and adults, doesn't it?
Right. So
Just
you're
the
talking
just
about
the adults.
respondents. Right, because I did the math, Jim.
Yeah.
Because I was having the same
But it's still
discussion over
3%
here.
seems.
Yeah, it's actually 24.84 for the most current data for the stuff I got during my email back and forth through Adobe today, and a percent of Umatilla County ROHP members, but of the respondents, only 3%,
Yeah.
which doesn't seem accurate to what we're seeing, but with the kiddos, it did, because we saw that 20% of those kiddos were OHP. So I just think we are going to have a higher Medicaid or Medicare population on those respondents because of the age. Because I did the same math.
Yeah.
I still think 3% is low, because I think a lot of people don't understand that they're the dual coverage. I think there's some education around that needs to happen. I'm right there with you though, because that was the first I said, Julie, that's not right.
Yeah.
You did.
What else surprised you guys?
The number of children that aren't in seatbelts.
For me, I think I wasn't surprised, but I was surprised was that cost is the number one reason for adults for not accessing dental care. It's not surprising because a lot of Medicare doesn't cover dental, but at the same time, there's so many resources within our communities to help cover the cost of dental, and we have sliding scale fees. We have the dental vans that come. That's something we really work on in our county. So I'm kind of surprised, and it just makes me think, what else could we be doing differently to let people know what the options are in regards to cost?
Or is it really just a reflection of the actual individuals who were surveyed?
Right.
That's what I think.
I think it's the who was surveyed.
So I think,
Which is hard with the survey, right?
right, I think that I'm hoping in the future that we have a more comprehensive group to survey. I think that there was a lot of wonderful information in here, but it's not an accurate.
It's not a
completely
random sample.
That's what I'm saying. I want to see more. I don't want to be snotty. I want to see more of a diversified group that would actually represent our community more appropriately, more accurately. That's just my opinion. So, yes, like I think there should be. I like the idea of mail, that paper mail, the postal mail, but I think there should be also email and phone polls and texting and people being invited to go to